Hi, my name is Casey Taylor, and I will be doing the clinician portion over bulimia nervosa, which is an eating disorder. So, to begin the prognosis of bulimia nervosa, bulimia nervosa is a public health disorder that focuses on binge eating and purging of food, as well as associating disorders within an individual's diet. Um, Being bulimic can potentially put your mental and your physical health at a higher risk. Um, and with individuals that are bulimic, about half of those individuals fully recover, and they only fully recover with treatment. So, with that being said, treatment is necessary and it is mandatory for individuals with bulimia if they tend on getting better and reducing, those behaviors. So, to continue the prognosis, the mortality rate of bulimia is at about a 1.7 death rate per 1,000 people in America. Um, Also, bulimia can co-occur with certain mood disorders such as depression, anxiety, stress, and then also there's a commodity between bulimia and personality disorders. So, as stated before, bulimia is can put you at high risk for health complications, and some of these health complications can be something as little as vomiting, low blood pressure, or cold hands and feet, or something as severe as having a decreased bone density, or maybe even having suicide because of those mood disorders that are taking over. So, with bulimia nervosa, there tends to be a reduction in brain activity. And when I say that, I'm saying because individuals who exhibit bulimia behavior, they tend to have lower levels of excitement and low levels of arousal. So that's why a lot of these patients, a lot of them are depressed and a lot of them are anxious and stressed when it comes to these type of things. So um as we were talking about before, with depression, stress, and anxiety, prior to treatment, those levels are at an all-time high for patients. And then as they begin to take treatment, you see that those depression levels, those stress levels, and anxiety levels, they begin to decrease. Once they're discharged, you will see that they are all at a low level. And then as those 3 months post treatment begin to roll on by, you see how your depression levels, they begin to decrease, and then your anxiety levels and your stress levels tend to kind of stay the same for a while. And then once you start hitting that mark for your 6 months post treatment, you see how they all begin to flow at their own little pace, and it just stays the same for a minute. So, for treatment for bulimia nervosa, they recommend psychotherapy. So, psychotherapy is conducted to alleviate bulimia and to reduce relapse. So, another treatment that they use is family therapy. Family therapy has 3 phases that they focus on, and we will get into that a little bit more into the presentation. So, another treatment, which is the main treatment that a lot of patients get, would be cognitive behavioral therapy. And there are 3 goals when using CBT. So, you have a didactic component, you have cognitive components, and you have behavioral components. So, your didactic component would be to help set up positive expectations for therapy and to allow the individual to cooperate with the treatment process that is going to be conducted. Um, Also, so your cognitive component, that helps to identify the thoughts and the assumptions that are influencing the behavior that the patient is exhibiting. So the behavioral component of treatment for bulimia nervosa would be to employ behavior modification to teach, I would say, a more effective strategy in dealing with problems that are stressful in life events. So also for treatment, a lot of patients with bulimia, they focus on inpatient hospitalization. Inpatient hospitalization is it's used more because it's more of a safe space for patients and for families, and to ensure that a relapse is bound to not occur. So some advantages for inpatient hospitalization would be to help with other health issues that are associated with this eating disorder. Um, Also, it can better address the suicidal thoughts that a patient may be exhibiting due to their low satisfaction of the self. Um, also, inpatient hospitalization, it can make it easier for individuals living from far distances to receive treatment, because outpatient, that requires you to be at home, and then you would have to commute from home to the hospital to receive treatment. Also, inpatient hospitalization, it is a safe environment for healing, and as stated before, it reduces the likelihood of a relapse happening again. Um, Also, it treats the severe cases of bulimia nervosa. So, the ones where individuals are experiencing suicidal thoughts, or they do have very high depression, stress, and anxiety levels. Um, it helps treat anxiety and depression along with the eating disorders that they are exhibiting. Also, individuals with coexisting medical conditions, they can receive treatment, and all of this will be in one. So to focus on the three treatments, so the didactic therapy, the cognitive therapy, and then the behavioral therapy. So to begin, didactic therapy has three basic assumptions. So all things are interconnected. So as I stated before, there's a commodity between bulimia and personality disorders. These personality disorders and the mood disorders, such as depression and anxiety, these are all developed based off of the mental state of the individual. So, also, change is constant and inevitable. So, mood mood disorder levels, they're bound to change. So depression levels, anxiety levels, they're bound to change throughout the course of an individual's experience with bulimia. So whether that's post treatment or after treatment or before treatment. So another basic assumption would be that opposites can be integrated to form a closer approximation of the truth. So how does this therapy work? So a group setting with the person is taught behavioral skills by doing homework or maybe even role play in order to get them to interact with other individuals. So individual therapy, that will be with a trained professional, where those learned behavioral skills are adapted in one's personal life challenges when they're by themselves and they don't have their therapist there to guide them. So that's why they work on those things. So when they do get discharged from treatment, they're able to handle those situations on their own. So another one, phone coaching is also another thing. So if an individual is not able to get to the hospital, their therapist will always be on call. So cognitive therapy, that has three phases as well. First phase, psychoeducation. That is to address the thoughts and the assumptions, as stated before, with the person's eating disorder. Second phase would be reducing the shape and the weight concerns and the dieting behavior that the individual is exhibiting. Third phase would be maintaining, planning, and prevention of relapse in the future. So that's why they have inpatient hospitalization. So how would cognitive therapy work? So cognitive therapy for bulimia, that would directly target the core features of the eating disorder. So mainly the binge eating and the purging of the food, as well as the excessive concern of body image that an individual may experience. Also, CBT, which is cognitive behavioral therapy for bulimia, is conducted approximately about 20 weekly sessions. So, family therapy. I said that we were going to get back to family therapy because family therapy had about 3 associations to how they conduct treatment with the patient and their family. So, the first one would be the family works with the therapist to help the individual maintain appropriate food intake and to limit the negative ways of their eating disorder and to use control of their weight. Also, after the bulimic individual has begun to control the negative eating behaviors, they are encouraged to take responsibility for maintaining appropriate eating and refraining from going back to those bad habits. In the final phase of the family therapy, the therapist would like to focus on more of the general issues of the eating disorder and the effects of bulimia and the normal activities and normal developments that can be examined throughout the course of treatment. So, with bulimia, of course, with treatment, there comes medications. So, with medications, individuals can be prescribed fluoxetine or Prozac, which is a serotonergic antidepressant. Also, they can be given venlafaxine. I'm sorry, I cannot say this. Venlafaxine, excuse me, I'm sorry. And also duloxetine, which is a serotonin norepinephrine reuptake inhibitor. And those medications, the reuptake inhibitors, that will reduce the extreme low levels of depression and anxiety, and it will begin to basically raise their mood. And so also patients can be given imipramine or amitriptyline. That is a tricyclic antidepressant. And then not only with medications and treatment, you have to have options in how to go about getting treatment because not all families can afford it. So with options, I'm saying, do you go with inpatient or do you go with outpatient hospitalization? So it all depends on the cost of treatment, which is also another option that families must think about. Also, was it the patient's choice or was it a suggestion from a family member or from a friend? Like most individuals, they have to want it for themselves in order to realize like that there's even an issue, there. Also, how much accessibility do you have to these resources to get to the hospital, or like I said, to pay for these treatments? So lastly, you have facts about bulimia. So as stated before, bulimia is an eating disorder that is characterized on binge eating and purging of food. Also, people who develop this illness, they tend to develop it before the age of 22, and many of the individuals who do develop it experience bulimia by the age of 15 to 16 years old. Also, medication, nutritional counseling, and family therapy, those are all parts of treatments for bulimia. The main big treatment for bulimia would be cognitive behavioral therapy. That is one of the more superior forms of psychotherapy for the treatment of bulimia. Lastly, the potential complications of bulimia can be severe, and they can affect virtually the organ system. And then that would be it. Thank you.